Right, let's talk to Dr. Bharat Pankania of the University of Exeter Medical School, who joins us now. Very good to have you with us again. It's always good to talk to you. And I want to talk to you about the important stuff about the vaccine rollout, about the Delta variant. I can't not ask you about the politics of all this, because it matters, doesn't it? What messages are coming out from the people at the top? How have you been feeling over the last couple of days about all this?
So I was reflecting and saying to myself, if I were Matt Hancock, who is going to listen to me in the middle of a pandemic on Monday? And that frightened me, because my fear was, if people stop listening to the advice, to the precautions, to all the things that we want to do to protect the people, and people are frustrated with all the restrictions that have gone on, I felt, I don't know how Matt Hancock is going to do this. So in a way, that decision has been made for us, and we've got Sajid Javid now, and I hope that he has the confidence of the NHS staff. And one thing that I picked up, one thing that's really, really important, is Matt Hancock said, we are nearly there. I disagree with him, and my reason I disagree with him is the world has not been immunized. So we really want Sajid Javid, of course, to look after the United Kingdom, but to also start looking after the rest of the world. It is really important, otherwise we will get variants.
And variants of variants. We're already hearing from India,
Indeed.
aren't we, that they're now finding I don't know what the technical term is, but they're calling it Delta Plus. So some kind of development of the Delta variant, which is causing them concern. They don't know yet how serious it is, but they are worried about it.
Yes, and emergence of variants is a reflection on uncontrolled immense reproduction of the virus, and the virus makes mistakes, and then a variant arises. So we've got to suppress infections the world over, and that is our next task too.
I'm really interested you saying that, because I've heard anecdotally a lot of people saying around talking to informally, in work, out of work, in social situations, well, more of us are being vaccinated, double vaccinated, fewer people are going into hospital. It doesn't matter if a few more people get the infection, does it? And judging by what you were saying, this rise of infections in the UK should be worrying us, and we shouldn't simply dismiss it and say, well, that's all right, more people getting vaccinated, we'll get more done by the end of the month. You know, we don't really have to worry anymore.
No, we mustn't dismiss it, because we don't know what's around the corner. I mean, 10 months ago, we were not talking about variants, and here we are, we're at Delta variant stage already. And my other concern is children and schools and colleges, because that's where the infections start. And whilst the young people may not get severe disease at this point in time, there may be a variant that could arise and start causing severe disease in the younger age group. Therefore, the protection that we have is the vaccines. And I really would like us to follow the United States model, where they're immunizing 12 years and above. And if it is possible and it is licensed, even younger ages, that will protect us. But we mustn't forget about the rest of the world. That is really, really important too.
Yeah, and you made the point, and we were hearing from those involved with the COVAX scheme, the international scheme, which obviously is designed to help countries who couldn't otherwise afford to buy enough vaccine for themselves, that some of those countries, I think as many as half of them, are already running out of doses.
Oh, yes. And look, I'm dealing with a number of African countries, and I feel absolutely powerless. They're telling me no oxygen, no beds, no vaccines, nothing. And I feel I don't know what to do. And this is the situation right now in Africa. And all the vaccine forward orders for 2021 have already been purchased. There are no vaccines that the Africans can purchase, even with cash, for their countries. There aren't any for 2021.
Do you feel some sympathy with President Cyril Ramaphosa of South Africa then, when he says that countries like Britain and the United States and others have been hoarding vaccines?
I do. I'm very sad that we're going to look after our country first before we start looking after other nations. This has to be a collective action together. We look after ourselves and we look after them as well, because it is in our self-interest, because variants will arise, and the Africans and the Asians and the others are not going to forget what we did. We went nationalistic as soon as the trouble arose. And how are we going to communicate with them and work with them on global warming, climate change, etc., if we let them down on the vaccines?
Returning to Sajid Javid, the new Health Secretary, and the job he's got, almost the first thing he's going to have to do come Monday, actually, is make an announcement on whether or not we're expecting to see the restrictions lifted on July the 19th. There's clearly a lot of political pressure to do that. From where you sit, what ought he be saying to us on Monday?
We will look at the data. And the data is looking promising, but we must scrutinize it. So the data about the rising number of cases and the gradient, in other words, it's speeding up, is worrying. On the other hand, because of the immunization, there now appears to be an uncoupling, meaning although we are generating cases, they're not becoming cases in hospital, very ill, etc. So we may be out of the water, but cautiously do it. And if I were Sajid Javid, I would be taking that slowly, cautious approach and be inclusive. I would really like a cross-party approach to this, because this is not a one party is sorting it all out. This is a national problem. Why don't we work with all the parties to sort it out together?
It's the time of great change at the NHS, of course, because Sir Simon Stephen, the chief executive, has announced his resignation, that he's going to be going in due course, and the government has to appoint a new boss to the health service. We know that one of the consequences of COVID, even if we get beyond the pandemic, is a legacy of waiting lists, of potentially procedures that will happen later than they should have done, and maybe in some cases for some patients too late. This is a big, challenging time for the NHS, isn't it? And you know, in a sense, it's losing its professional leader. It's just lost its political leader and is getting a new one. I mean, how big a challenge do you think that is?
It's a huge challenge, and a lot of pressure has been building up. So we've got all these people who should have gone to their doctors who did not go because they were frightened of from bothering the doctor or the hospital because they were full of COVID-19 disease cases. So we have a lot of catching up to do, because remember, if we don't treat that high blood pressure, that heart disease, those cancers, then those people are also going to die as a result of COVID-19, although COVID-19 didn't kill them. It was that delayed intervention that unfortunately led to their early deaths.
Dr. Pankhania, you're at University of Exeter Medical School. What's been the impact there on the students over the last 18 months, or 15 months?
I feel so bad. They feel bad. So I really enjoy teaching my students, because I have 35 years plus of experience as a GP, as a hospital doctor, as a public health doctor, as an infectious disease doctor. And that pleasure of being in front of them and teaching them all that I know has been missing, and they have been missing that interaction too. So it has been a loss for all of us, lecturers and the students.
Dr. Bharat Pankhania at the University of Exeter Medical School. Always a pleasure to speak to you. Thank you very much for being with us on BBC News.
Thank you.